So far in the series of learning modules, we have looked at the initial assessment and immediate actions in an investigation, as well as the steps of root cause analysis and risk management. We will now move on to look at how to assign CAPAs in an investigation. At this stage in the investigation, the number of root causes and contributing factors has been narrowed down as far as possible. By the time you have completed this module, you should be able to assign CAPAs which eliminate or sufficiently reduce the risk and effect of the root cause and contributing factors, and create effectiveness checks which are appropriate to the assigned CAPAs. So what are CAPAs? Let's look at some useful definitions. So what are CAPAs? Let's look at some useful definitions.
Let's see if you can apply what you've learned. For each of the following examples, indicate whether you think it is a correction, a corrective action, or a preventive action.
Did you get the right answers? Let's take a look at what Quality Directive 3.4.03 says about the CAPA plan. A CAPA plan is made up of individual actions which will be taken to address the consequences and the identified root cause or causes of an event. Sometimes a CAPA plan may not be required. In this case, the reason for this decision must be included in the event record or investigation report. The CAPA plan must be documented and must include all identified corrections and CAPAs, any interim controls, and any required effectiveness checks. Each action in the plan must state the nature of the action, who is responsible for the execution of the CAPA, and the due date. Follow these steps when creating your CAPA plan. First of all, consult with and gain consensus from all stakeholders, including each potential CAPA owner, and be sure to include the project sponsor. Describe each CAPA with its purpose and scope, and specify the owner and completion date. Then develop effectiveness checks where applicable. In order to create effective CAPAs, a checklist can be applied as a reminder of actions and requirements at each of the following steps: definition and selection, description, and results and conclusion. Please take time to download and read through the checklist. You will use it throughout the module. Consider the following as you write the CAPA. Identification of robust, sustainable CAPAs that tackle the root cause. Quality versus quantity. And how to measure effectiveness of the CAPA after implementation. Let's look at the checklist in more detail, starting with CAPA definition and selection. You can use this first section of the checklist prior to initiating CAPAs. 1. To ensure that actions are properly defined. 2. To see if there are opportunities to identify preventive actions as a result of the investigation. To proceed with this checklist, ask yourself each question under the CAPA definition and selection column. Then answer yes or no. And lastly, locate the recommended action in the last column. Consider completing the proposed action as a correction or preventive action means that although it is not addressing the root cause, the selected action may still be valuable. You can use the next section of the checklist during initiation of the CAPA record. Does the CAPA record contain a concise summary of the deviation? Is the purpose clearly stated? Is the scope clearly stated? You can use the next section of the checklist for CAPA owner's review of the record and QA review of the completed record.
Let's see if you can apply what you've learned about defining CAPAs. We're going to return to the airline incident. Throughout this module, we will look at some suggested CAPAs for the incident. Select the link to remind yourself of the incident and look at the first CAPA. Then answer the questions to evaluate the CAPA using the checklist as a tool.
Did you get the right answers? Read the description of the CAPA below and think about whether this is an appropriate or effective CAPA and how that relates to the root cause. What if we clarify the root cause? It is clear that you need a solid root cause to generate effective CAPAs. CAPAs might also come from or be influenced by the risk assessment. Let's look at considering risk when assigning CAPAs. Let's look at the airline incident again. how effective will this CAPA be in reducing severity, impact, occurrence, and detection? In this example, the values for occurrence and detectability are greatly reduced due to the increased number of checks, so the overall risk is greatly reduced by implementing this CAPA. Severity is not reduced. However, the incident is now less likely to occur due to the actions required by this CAPA. It is possible to predict the success, that is, the effectiveness of a CAPA, prior to implementation. Effectiveness can be measured in terms of three parameters: robustness, sustainability, and specificity, as shown in this table. Select each parameter now to view more information. Once actions have been completed, they need to be reviewed. In order to ensure that CAPAs were performed as assigned, check that each of the actions in this checklist has been completed. A summary has been provided. A rationale was provided for any actions which were not completed. A rationale was provided if an effectiveness check will not be performed. All attachments are referenced and explained. What is an effectiveness check? The effectiveness check is an evaluation performed to confirm that the desired outcome of a CAPA was achieved. Effectiveness checks allow for constant monitoring of the health of our CAPA system. Quality Directive 3.4.03 contains the requirements of an effectiveness check. Where required, effectiveness of the CAPA plan may be checked through a system review or a review of the outcome of individual actions. It must include an assessment of any unintended consequences, and it must define the persons responsible and the completion date. Finally, completion must be approved by the quality unit. The effectiveness check specifies what the expected results should be, who is responsible, when it should be performed, and the specifications and methods for collecting results. What does the effectiveness check document? That the root cause has been removed or reduced. Any resulting secondary situations were corrected. Proper controls have been established to prevent a future occurrence. The actions had no other adverse effects. Adequate monitoring is in place, and acceptance criteria and time frame are rationally justified. What should you do if the effectiveness check shows that the CAPA was not effective? Go back and review the process so far to determine the next step. Whenever you judge that an effectiveness check is not required, you must provide documented justification.
Let's return to the airline incident, for which CAPAs have now been assigned. This is another CAPA for the airline incident. You are now going to assign an effectiveness check, if necessary, for this CAPA. Which one of the effectiveness checks shown in the next step would you assign for this CAPA? Remember that the effectiveness check needs to be well designed and address the long-term requirements for the CAPA.
We have seen how the creation of CAPAs is dependent on root cause analysis, and that generating effective CAPAs requires a solid root cause. We have also learnt about the effectiveness check, which is the last review point of the CAPA process. Once the CAPAs have been created, they must be written up as part of the investigation report. As we have seen, there are expectations for a properly assigned and documented CAPA. We will learn more about how to write up CAPAs and the rest of the investigation in the report writing module.
You will now take a short assessment which consists of 5 questions about CAPAs for a temperature excursion. The passing grade is 80%. All of the questions will concern the CAPAs, corrective action summaries, and effectiveness checks that were created for this incident. Select the link to download the CAPA checklist. Either print the tool or keep it open on your desktop, as it will assist you in answering the questions. Let's look at CAPA definition and selection for the temperature excursion. Read the incident description again, and then use the checklist to decide which of the following actions should occur for CAPA 1, which you can read below. You must now examine CAPA 1 for the temperature excursion using the CAPA description section of the CAPA checklist. Work through the questions here. Has the owner of this CAPA accurately documented the actions which were carried out? Now that you have evaluated the description of CAPA 1 and reviewed the CAPA summary, you must decide if the proposed effectiveness check is adequate. Which aspect of risk cannot be reduced by CAPA 1 for the temperature excursion? You have now completed the assessment. Follow the instructions on the screen.